nursing is art and also it is a science which provide basically the holistic care to the patients. So ma'am is currently working as a CHO. What's your role in the hospital as a CHO?
The word itself is telling you it's a community health officer, means you are working for community and for a health, and you will be an officer over there.
This CHO, it is the opportunity for all the BSc students. They can, after passing the BSc, they can directly
Work as a community health officer. It's not only for BSc students, the GNM students who have cleared their PCBSc.
The one word comes called care. This nursing is all about to provide the care to the patient, provide the care to the community and other fields. How challenging for you to provide the care to the patients?
Very sedatively, what we can say that sometimes even after caring so much and doing some follow-ups, some patients will not be so responsive. We have to accept it.
In this nursing curriculum is here we have to write so many things. The written section is like so hard. We got so many assignments. These assignments is really like helping us in future for in job.
When you write, you will remember. Case studies, I really suggest all the students, it's just a route map for you.
As a human we seek the comfort, so teaching is more comfortable or working as a nurse is comfortable for you?
I was more comfortable, I can tell you. Response of the patient, what gives me is different.
I want to know, ma'am, why you choose a specialization in medical surgical nursing?
Dealing with certain diseases and understanding them is most important, what I felt as a nurse. In nursing, any subject if you take also, you should have a passion to go behind it.
Ma'am, you highlighted the one exam name called NORCET. So ma'am, like many of our viewers want to know about this NORCET exam because it's like a dream for a nursing student.
Yearly twice this examination will be conducted from AIMS. All branches of AIMS are coming together and they're conducting the exams.
Peoples, they are believing on superstitious power. How you are managing those basics?
Superstition is not about only one small thing. There, even from the baby which is newly born, from there to till the death of the person, there will be a number of superstition. They'll say no, we will not allow the first 3 days of breast milk. It's not allowed. It's very thick.
What qualities should one nurse have in your perspective?
I can say in very single word, as a patience.
Patience. This is I want to ask that, ma'am, like why Indian nurses are famous in all over the world? Why? What's the main like core reason?
Because Indian nurses are so strong.
Strong. Yeah, and one thing is, ma'am, as I experience, like we are more aligned with our culture. So we know the real value, how to provide the like authentic care to the patient. In this digital world, in community, what are the new challenges to deal with that? Hello friends, it's a pleasure to have you back on the channel of Clinical Care Insight. In our today's podcast, we have a distinguished guest and her name is Miss Maulya VS. She is specialized in the medical surgical nursing. She did the masters in the medical surgical nursing and also she is currently working as a CHO in Nilmangala Taluk rural. As we know that nursing is art and also it is a science which provide basically the holistic care to the patients. It not only provide the holistic care to the patients, it also helps the other healthcare workers to operate their works smoothly. So we will see the one of the services as a CHO. So ma'am is currently working as a CHO. Ma'am, my first question is, what's your role in the hospital as a CHO?
I'm Maulya, basically qualified in medical surgical nursing, and though in MSc, there is no direct connection for the community. I totally take this opportunity to work as a community health officer based on my BSc nursing degree. So to work as a CHO, we don't need a MSc actually. The BSc standard students who just pass out, they can also take up an exam and they can also work as a CHO. That's a major opportunity for BSc students when they actually get passed out. When we got passed out in 2017 and all, this opportunity was not there for us. This project came little bit later from Government of India, that too under this National Health Mission. So this really created a great opportunity for the students throughout the India. It was not particularly for one particular area. Initially, it was started as a pilot project in India. Only selected states were done. Once the government felt like this is helpful for the community, then started implementing all over the state. Means all the states in India, now you can see there is a CHO. The post which was not there at all in the before, the government has started it. So they created an open opportunity for all the BSc nursing students, and they can directly work as a community health officer. See, the word itself is telling you it's a community health officer, means you are working for community and for a health, and you will be an officer over there. So whatever you are doing, you are learned your throughout your nursing career, you will be implementing directly in the community level. Okay, the community means it's not one person, it's a group. We can see, right? There are almost all set of people we can see from all the ages, like from zero to till death, everybody will be there. And I really feel very, very happy to work as a community health officer than working in one set of hospital and caring only for the patient whoever allotted to me. But now I feel entire community is our home, and we have started caring both the person who is normal, he need a health education,
Hmm.
and person who is abnormal or who is ill,
Hmm.
he need a treatment,
Hmm.
and who has already got treated, he need a follow-up care. That we are doing. Okay, that's what makes us different from others.
Means basically you are helping the people in three ways, as you said. The one is to provide the follow up to the patient who is already cured, and those who are ill you provide their treatment, and also for education, the patient education. These three main things you are
That's
providing.
most important.
That's most important. And one thing you also mentioned that this CHO, it is a opportunity for all the BSc students. They can, after passing the BSc, they can directly. Is there any exam, ma'am, a specific exam?
Yeah, I can also stress one more point. It's not only for BSc students, the GNM students who have cleared their PCBSc. After GNM, if they have cleared their PCBSc, even they are also can choose this job. It's not like only I have done GNM, I have to work only in hospital sector as a staff nurse. No, no, not like that. Even if they have taken any exam and cleared their PCBSc, they can also opt for this exam. So when CHO, if you want to work, definitely from the state, they'll be calling district wise. It's not like all over the state randomly they'll call for an exam and wherever they want they'll post. It's not like that. They'll give you the open opportunity to choose the district. Suppose if I am basically from Bangalore or a Bangalore urban, I have an open opportunity to choose which district I need to apply. And then we have to apply it over there, and then we have to give a exam. And after qualifying in an exam, then again, before when we were doing as an non-integrated batches, by that time we had got around 3 months of extra additional training for the CHO. But now the syllabus has been changed, that final year students in the BSc, their syllabus has been merged with the CHO syllabus, so they don't need to go again on a training of 3 months. Briefly, I think around 15 days of training will be provided from government, and after that again one more exam will be given from the department itself. There we have to score little better because we want to choose the places, like it's just like counseling, the place which you want to go, where you want to go, and which location you have to choose. Based on that marks, they'll allow you to choose it, and then we can just post it. But definitely there will be an exam, you have to. It's just like roster come merit method, the same way of other exams.
In the nursing, I am also a nursing student. And for my viewers, ma'am already taught us anatomy. She is my teacher. And ma'am, one thing I noticed from first year till now, I'm in third year right now, the one word comes called care. This nursing is all about to provide the care to the patient, provide the care to the community, and other fields. Sometimes maybe it's challenging for you to provide the care to the patients, and how satisfactory it is for you.
Care is comes with the challenges. Here, first thing, the CHO should be accepted by the department, because you're very fresh and newly created opportunity. When you go to a new field or new place, the people, the around your colleagues, they need to accept you first. So, very first, what we need to give yourself is keeping ourselves as low, like in egoistic way, we have to keep ourselves little low. Get friendly, get adjusted to the environment, like introduce yourself. Though you know more than others or less than others, whatever, we should have that humbleness of learning always. Whatever we have earned is not sufficient to cater the public. So every day is a new learning in nursing, as I feel. Even in the entire medical field, every case, every person, thing is new. See, CHO duty will be like something, there will be a routine, daily routine will be provided to you, like time to time how long you need to see the OPD, and then you have to see the school visit, then you have to go for a home visit, and then you have to do the follow up care, and you have to go and check the anganwadis. In that anganwadis, you have to check all the children, how is their health status, whether they are according to their height and weight, their BMIs, everything need to be calculated. So nobody will come and allow you to enter their house in very fresh you go there. So that's the reason where you need your team. The people who are working with you, just like the other PHCOs and HIOs, they have to come with you and they have to introduce you, like, see, this is the person who has been posted as CHO, and you have to keep a good communication with your panchayat. Yes, it's like community health officer. It's not like one single person who go and handle everything. It's not like that. It's like a teamwork. We have to develop our network. We should know every person, from the person who is working in ground level to the higher level. You should know the group D of the panchayat also. You should know the that main president of the panchayat also. We should have a I have to work with the PDO, panchayat development officers, and we have to work with the waterman sometime, because we need to get tested the water quality also. There are n number of roles and responsibility in a CHO. For example, if you go for a school program, you have to prepare yourself, like, which who is your audience. Today's my audience may be girls, adolescent girls. Maybe we may be educating them about the menstrual hygiene, so the topic will be quite important for their age. And when we choose the same adolescent boys, we need to educate about the alcohol, non about the smoking, addictive behaviors, what happens to them, because they're very curious in that age. They want to experiment everything. So in that cases, this is really feels like a challenging. Every day is like a challenge. But very sedatively, what we can say that sometimes even after caring so much and doing some follow-ups, some patients will not be so like responsive for you. We have to accept it. But when it is not possible from our hand, we should go to the next step. So that we have to continue to do.
That's awesome, ma'am. Ma'am, one thing I noticed in the this nursing curriculum is here we have to write so many things. The written section is like so hard. We got so many assignments. These assignments is really like helping us in future for in job.
If you ask me in that way, like when I feel myself as a student, my for me also I got plenty of assignments, plenty of case studies. But when you write, you will remember. When you write something, you will remember something. When you're drawing some picture, for example, NG tube intubation, when you're drawing that picture, somehow that will go and register in your brain. When recently, when I was supposed to do an NG tube intubation in a normal other area where nobody is there to help you or guide you. So imagine you are a single person, directly the patient is a stroke patient who can't take oral any feeding. By the time we need to intubate the patient, I can't go through my books. What makes me to memorize is what I wrote, how to do that. So writing is not bad thing. Writing makes you more understandable. It's like read, win, forget. Newspaper, every day we read newspaper sometime. Do we remember every news? Definitely not. Maybe we may take some note out of it and we may start writing out of it. That's really helpful for us. Like we will memorize. And coming to case studies, I really suggest all the students, don't take it as like a homework or a burden or a punishment for you. Take it as like a subject and feel it just like a you're doing something to the patient, you're understanding something to the patient. Don't write randomly like S1 S2 is heard in the respiratory system. Don't like that. Have you really heard it? Have you really felt it? S1 and S2, really have you felt it? Then your feelings are different.
Many time, ma'am, like I myself copy the same case
Yeah,
study from my
yeah,
friend.
but situation won't be the same. So when we check that patient and write the case sheets, then you will understand that case need to be written. Sometimes we write everything normal and we focus on only one particular disease condition. For example, kidney stones, person, renal stones. We will just everything normal, 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 and only in that particular system we will mention this is abnormal, this is abnormal. Do we think this is only the system is getting affected? Actually, not. When some system is getting affected in major way, definitely it will affect the other systems also. Blood values will never be same. When there is a kidney stones or a renal stones in the patient, his blood values will be different. We should understand it. That's the reason we have to write the case sheets. But what happens in nursing students, like they'll think like this is like a burden, why teachers are punishing us. But because we are not going through the case sheets. Go to every patient, start assessing them, start making a note out of it. The entire assignment is like a what I can tell you, it's just a route map for you. How to read a case. how to understand a case sheet, and how to check your patient. That is only a guide mark for you. You don't need to make a copy paste out of it. When you go and work in a clinical sector, this is the same way you have to assess it. Very first, when you start writing your case sheets, what you will be writing? The demographic data. Definitely, we need it, because if I don't know who is the patient, then what I'll be able to explain? We cannot put the wrong treatment. So, demographic data is important. Chief complaints are important, because we need to what problem he has got, and what about his past history and present history, what he has taken, what he has done. So all these things are really important. Sometimes diseases will be different. So coming to in our part, communicable diseases are most importantly we are dealing with in community. Example, TB, tuberculosis, which is now people may sing in this particular Bangalore. If I speak about tuberculosis, they may make joke of me like, "Ma'am, in this time also, do you think there is a TB?" There was an era where people were dying with the TB, but still I can say there are 2 3 cases. Freshly today morning, one case was reported in my own sector. So this is not something like you can forget it. So step wise we will be assessing, and then like some of the will be having a family history. Cancer, there are many people we have seen they have a family history, and cancer is spreading to the generation after generation, and people are suffering. So there again our history matters. And this communicable history, again coming to the tuberculosis, we should know the person how he got affected. We can see in back 2020 there was a COVID affected everywhere, where the travel history was more important, where this person has gone and spread everybody. So again, history is again important. So nursing students should not think like writing an assignment is a complicated thing. Understand in such a way like, why are you writing it? Because it's just a route map which you shouldn't forget at all. At any cost of your life, wherever you gone and thrown out of the world, you have to follow the same route map to get your conditions and understand your patient.
Ma'am, one thing you mentioned that tuberculosis cases, and you also mentioned that about the communicable diseases. And ma'am, one thing I noticed, our community posting will start soon, and one of my teacher he taught us some of the basic test about the albumin, how to find out the albumin. Apart from that, some of the other urine test, and how to calculate the hemoglobin level. Then I one thing I noticed, like in the community area, these tests helps to early detection. So ma'am, like if you find some cases like a tuberculosis and in any other cases, so are you referring again to the further further next to any other department, or you are dealing yourself only?
No, no. Obviously, when you find any fresh cases in a community, as a community health officer, your first responsibility is to prevent the disease. Further thing, very first promotion will be given from this community postings or whatever. Whatever we say is like prevention is always better than cure. So always think of preventing further spreading of this tuberculosis to their own family first, and next to that, other houses, the neighboring houses, or to their own area. That person shouldn't spread that disease. So very first, what we'll do, we will identify the person, and based on his signs and symptoms, we'll be sending some of the samples for testing. For example, we'll be taking a sputum test very first. We'll send it for sputum testing, and then we'll do with the X-ray. So when we get confirmed from both the side, what we do is we will definitely refer that person for the PHC level, at least to the PHC level, because medical officers should have an information of like what cases we are dealing with and what extent this person has got affected. There are so many cases of hypertension, and there are so many cases of diabetes in the early stages we can detect, and we can put them on treatment. So that is indirectly helping us to prevent lot many cardiovascular diseases, sudden strokes, and any kind of we can see CKDs. All these problems can be prevented out of it, because loss of one person will not affect only that person, the entire family will be affected. So that's the reason I think communicable diseases can also be detected in very early age. When we see with the camps and routine screening, really helps a lot.
Like your job is amazing. Amazing is something you preventing on the ground level. It's like something extraordinary. And ma'am, one thing I want to say, and that is, ma'am, as I observe, we are doing the nursing as a student. I am doing the nursing, and most of the student they are we are studying. But like our mindset is, ma'am, we want more theoretical rather than the practical. I don't know why. I mean, like, but we want more to be theoretical, and that's why instead of going to the clinical field, we want to choose teaching as a profession. So is it a good mentality, ma'am?
So teaching someone is not bad thing. I really suggest. I really love teaching. Was my passion when I came out from nursing. Even I didn't choose much days to work in clinical area, but I really regret about it right now. But I suggest all the students who come pass out from BSc, it's really better to go and work at least minimum 2 to 3 years in clinical area, because you should know practically what you're teaching. If you want to teach somebody, you should know what it is. Theory of preparing a coffee will be very easy, right? The person who don't know how to prepare the coffee, even if you give everything in front of him, he can't make it. You should know that perfectness. Like, there is a coffee powder, there is a sugar, there is a milk, and there is everything, but we should know the proportion. Okay, we should know the proportion, when to put, what to put, when it's supposed to be boiled, what is the timing. Theory may say it's like 1 spoon of sugar and half spoon of coffee powder, everything it will be saying, but still you should know the timing, what to be done. So when you're getting theoretically good, but practically when you understand, you will feel even more powerful. I can say there are people, if you go and just do an normal interview with the nurses who are working from, even though what they are, like even they are educated with only A&M, PHCOs currently they are called as, and maybe they have just got only the diploma certificates, not even diploma, like certificates of the nursing. The person who has 10, 20 years of experience in the clinical area, they'll tell you the better experiences than the person who has got PhD.
It's true. It's true, ma'am.
Theory can be done. It's good. We should have a theoretical knowledge. I'm not discouraging, but we should have at least minimum practical experience to handle the case. We should know how to gentle your patient. I may say plenty of things how to put IV cannula, but still the confidence while you're pricking that patient, it's different. Okay, you should know when to catch the vein, when to hold, and how to put it. That's what is actually the practice.
And ma'am, like which is like, we as a human we seek the comfort. We are seeking the comfort. So teaching is more comfortable, or the nursing as a, like working as a nurse is comfortable for you?
No, when I was
I know you are doing the both the thing.
no, I was doing teaching. When I was doing my teaching, I was more comfortable. I was more comfortable, I can tell you. Like I had my friends with always with me, and I was scheduled timings like for hardly 1 hour or 2 to 3 hours of classes, and then again preparing for theory and getting back to home on time. This was my comfort zone. And so I was not even worried. Like even I was also feeling proud when others call me ma'am, sir. Oh, ma'am, that's good, no? Like I was feeling like that. But when I started working as a community health officer, now I feel, now I can feel the response of the patient. What gives me is different. Students also has given me. I'm not discouraging that, but when we work in directly on patients, and when we cure somebody, that's something like which you makes you feel successful. Okay, when you do some care to the patient and patient is getting recovered day by day, that makes you happy. That smile what comes from inside is totally different. So uh, both are good, both are good, but teaching and educating can be done even if we are not in teaching also. Okay, like any person, any of our juniors who comes with us and they may ask something, what is this? If I'm teaching him, if I know to, if I have that confidence to teach him, that's more than enough. I don't need to go and give a lecture on the class and say like you have to do this, you have to do this. See, I may say many things, but the person who comes to me and asks me to explain and get learned and go, that reminds me a lot. Like he'll be having that gratitude more than the persons who people we are teaching in the classrooms. So classroom teaching is totally different. And now what we're teaching in community, now also we are teaching, we are educating the public. Straight away we are educating the public. We are saying quit smoking, otherwise it will hurt you. And definitely your family has to run along with you. So that is also a different kind of teaching. So teaching is like infinity.
Yes. Like as I understanding is nursing and teaching is not a separate, and both are not a separate. Both are the same thing, because in the workplace we are educating the patient, and in the classroom we are educating the student.
It's a direct nursing care and indirect nursing.
Direct nursing care, yes, ma'am. And ma'am, if we talking about the scopes, so before asking these scopes about the nursing scopes, I want to know, ma'am, why you choose a specialization in medical surgical nursing?
Medical surgical nursing. See, medical surgical nursing, as per me, it's actually a very big subject.
Mm-hmm.
Very, very big subject where you have to learn every system in detail in your very first year.
Mm.
So I felt like dealing with certain diseases and understanding them is most important. What I felt as a nurse by that time. So because I was not even thinking about the community when I was choosing my MSc, I was never thought like I'll go for a community level and I'll work. By the time if I had opportunity, maybe I would have taken community health. But medical surgical nursing was make me really feel something good. Okay, we are understanding different systems, different condition, how they're going to be get treated, and and the scopes of medical surgical nursing if we are going for a year abroad was really good actually. And even now also it's really good because if you work as a ICU nurse or somebody, automatically they'll be getting easy opportunity to shift to the abroad and getting placed even in India was also good. I was in that zone and I was thinking, and I chose medical surgical nursing when I was about to choose MSc.
You want, ma'am, any further studies in your specialization like PhD?
Planning so, because of our contractual period of 3 years is about to get closed in the next month. Planning so, we'll see how it comes.
Okay, ma'am. And ma'am, what about the other specialization in nursing after the BSc? What are the other specializations?
About higher educations means obviously MSc, and that I may not recommend you to take particularly this subject or this subject. In nursing, any subject if you take also, you should have a passion to go behind it.
Passion, ma'am.
Yes, if you're taken a example a OBG, there also you will having an open ocean of opportunities. In many other abroad countries where you have seen they are going to run their own clinics with the permission of government and all, their OBG will really help us running ANC clinics and all, and doing some follow-up case. And community also has now it's a growing subject and trending in India. Community is also a good, and that's why I say like in nursing any subject if you take also it's really good. But apart from that, but every students whatever whoever doing nursing, I suggest get some little practical experience.
Practical experience.
Really important whether you want to work in India or going through some examination. Now they have made it little mandatory for every exams to have little experience, at least minimum 2 years experience, 3 years experience as an essential criteria
Hmm.
to clear with our examination. So for example NORCET, zipmer or any SDPJ if we take, in some sectors they are making little bit mandatory even for GNM students also. So getting exposed to the practical is really good.
After that, we will go to the specialization. I mean, after doing the BSc,
Gets take a break,
take a break.
2 years,
Okay.
get practicals, and then continue your education. It's really good. That's what I suggest.
Ma'am, you highlighted the one exam name called NORCET. So, ma'am, like many of our viewers want to know about this NORCET exam because it's like a dream for a nursing student. As I understood, because I seen my seniors, they are preparing for a NORCET exam, and I myself want to know that what actually it is.
See, when we passed out, there was no NORCET examination. It was almost now what is running is NORCET 8 something. So it was recently started, like almost around after COVID, I can say it. Yearly, twice this examination will be conducted from AIMS. All branches of AIMS are coming together and they're conducting the exams. So before it was like every different branches of AIMS, like AIMS Delhi will be conducting their own exam, AIMS Hyderabad will be conducting their own exams. So now all togetherly, there's one single entrance exam, NOSET. So there what you have to do is you have to keep your little extra time to study.
Little extra time.
And before also, even just previously, I think from NOSET 5 onwards they made little changes. There was only one exam in that till that. Now there are two exams again, NOSET prelims and mains. As we write our UPSC, There is a prelims and mains and interview. Possibilities of interviews are not here till. And now in NORCET there will be two exams. Like one will be prelims and one will be the mains exams. So they may say like in prelims there will be only basic questions will be asked, and in mains some of the detailed questions will be asked. But the effort will be the same, because only in the span of gap of 1 month from prelims to aims they'll be conducting two exams at a time. So better students who want to clear their NORCET. Suppose if you're in your third year right now, this is a very, very best time for you to start studying. Okay. So focus you on your academics also equally, because you need to clear your subjects every time. And then once you get passed out of it, meanwhile, you try give at least 1 or 2 hours for this NOCET preparation. There are very good books or even suggestibles are there, and even some of the coachings, online coachings are available. It's not like in our time, like there is no much online and there was no much publicity, there was no online coachings and all. Now it is, everything is like at your fingertips. You can utilize it. Now along with, more importantly, the friends are with you, your teams are with you. You just need to give it time and you have to just initiate. If you initiate, just start preparing for it. Work on MCQ, take some old question papers, so that you will get an idea like what kind of questions will be asked. Once you go through the prelims and mains question, that's what I'm saying, why nursing students need practical exams, like practical experience. So the most of the questions will be from like a practical.
I seen, ma'am, some of the questions.
It's not like only theory I read and I'll go and do it. It's not like that. Most of the things even comes from your practical area also. So that if you start preparing now itself, once you pass out, you may give little extra time, like around span of 6 months or anything. You can give an exam and you can clear it. And there will be age limit also for those things. For general merit and all, hardly till 30 years only that exam you can take or give a exam. So better try earliest and start preparing for it.
I seen one thing in that question papers. I mean, in-depth pharmacology is asked, but for a nursing student, I mean, like pharmacology is really challenging because now what scenario is going on, ma'am? You are already aware about that. Is the semester-wise exam, and this much time period, like I know the syllabus is reduced, but ma'am, हम लोग को मैम depth knowledge नहीं हो पाता है because the time lacking. And as I seen the some of the questions, they are asking about certain drugs which is used to manage the mental diseases. So how important for a student to study, as a nurse student, to study the pharmacology? Is it really to understand it in a depth, or superficial is okay? Okay.
Obviously, I feel like if you learn pharmacology, you're just like a master of everything
Okay.
in nursing, because you know to care the patient, you know what to be done to the patient, and you can understand the signs and symptoms of the patient, and you can go through the lab values and everything. Even after knowing everything, you don't know what to be given. Then what is the point of knowing?
Ma'am, this is happening. Like sometimes our like our guardian sends the prescription. Ki read it what it is, how to take the dose.
Why? See, once you pass out or once you join in the nursing, immediately, for example, very first your family will start asking you why this medicine is given, why we should take, how it should be taken. All these questions, why, what, when, all these WH questions will be asked to you. And the same way, the patients will also ask you.
Mm.
It's not only your family. Once you start working in hospital, they'll ask, sir, these tablets, how I should take this, when I should take this, and why I should take.
Yeah.
All these questions they'll ask you. Can we sit blank
No.
in front of them? No, definitely. We know these questions are expected from the community or from the patient or from our family. Then definitely we need to be prepared for it. Pharmacology, I can say it's 100% important for the students. You're studying all the subjects, like maybe you have your own routines or daily schedules for studying, but I suggest keep that in that half an hour for pharmacology, particularly until unless you become thorough of it. For example, paracetamol. Now everyone knows why the paracetamol has been taken. In the same way, there are plenty of drugs which should be at least in your tip of the tongue to see like how it should be given, why it should be given, and what is the usage out of it. And the same time, adverse effects, expected adverse effect, allergic reactions will be happening. For example, CPM, chlorophenolmanate, why we need it, why we are using on patients, and what age. And again, pediatrics makes you to think again before giving any drug because of their higher weight and calculation. what dosage should be suggested. That's the reason for pharmacology I say like give some half an hour until unless you become thorough.
Most of the, I can say, the community members, the peoples, they are believing on superstitious power. They like, they not consider the treatments, they reject the treatments. So how you are managing those patients, ma'am?
So challenging can be of different types. Okay, until unless I was in the four walls and teaching area and more comfortable, I was also not exposed to it. When I started exposing it, then I understand there are plenty of things. Superstition is not about only one small thing. There, even from the baby which is newly born, from there to till the death of the person, there are really a number of superstitions. Not only thinking superstition is applied only for mentally ill patients.
Mainly we are thinking for men.
We will think only of mentally ill things. For example, in pediatric section, we say for newborn baby from 0 to 6 months, exclusive breastfeeding is suggested from our side, right? And we will not say like don't give any other things other than the breastfeeding, which is more essential to the baby. But making the people to understand about this is not so easy in public. They'll not accept because their grandmothers will be their mothers and grandmothers and their fathers and forefathers. Everybody is following some routine, and they'll say, no, 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 we will not allow the first 3 days of breast milk. It's not allowed. It's very thick. It's not allowed. Baby will get diarrhea. Baby will get stomach pain. All these kind of challenges will be.
But that milk is important, cholesterol.
Yes, it's most important to the baby, which builds the immunity in the baby for all future diseases. But the public is not so easy. I'm not saying all 100% will do this. At least one case in the 100 people is again challenging for us. So what we have to do is we have to educate into their own ground level. That's what I say. Like we need to be very friendly to the public. We cannot go like, yeah, I'm a community health officer. They have to listen to me. I'll hold them like this. It's no, you have to go to their ground level, you talk in their tone and stand in their shoes and then understand them, then explain them. This is not the way you have to do this. You have to take it in this way. We cannot change all the 10 out of 10. At least if we can change 8 out of 10 is good. Another 2, we'll try our level best to do it. Even if it is not possible from our side, we cannot stop there. We'll call the other person who is furthermore qualified enough for us and who can make them understand. So we have to take it as a challenge as every day, and superstition has to be removed in India. But I'm not going against the herbal medicines. Some herbal medicines are really good and it's working. Even we suggest it. What we say, for example, in diabetic cases, we say like you continue to take your herbal medicines. We are not going to say your herbal medicines are wrong, but don't stop the whatever allopathic medicines we are suggesting. Please take these tablets, the metformin 500 mg, what is allotted to you for the daily, that you take along with your herbal medicines. You can take, no issue. So what, making the superstition completely removed is not possible. Sometimes it takes even more long way, but as it was there in our old days life of our mothers and fathers, it was not so. It's better now, I can feel like.
Better. And also you are not giving up.
Yeah, we should not give.
You are not, you are trying.
Like if we started giving up is very easy task.
It's easy, yes, ma'am.
Yeah, it's very easy. He's not listening. I can't do anything. I can say very in a single line and he can give up. It's not so. See, encouraging the patient to take the medicines of even with the tuberculosis or COVID or even with the diabetes, it's not so easy. They'll not make it as a routine. Making them follow, again going and contacting them, educating them, repeated visits may make the people change their mind.
And ma'am, what qualities should a nurse, one nurse have in your perspective? What quality you are looking in a one nurse?
I can say in very single word as a patience.
Patience.
Patience. Most importantly, you should have your patience. Don't lose your temper. When someone screams at you, when somebody says sometimes at you, I can say that when we are doing some arguments, we should know instead of raising our voice, we can uh, give more importance to the content of what we are talking. Okay, content is more important. Improve the quality of the words what you're talking. Okay, so that makes me the people understand it. And patience, if we don't have, If we lose our temper very easily, we can't deal with the higher authority, we can't deal with the public or our patient, or sometimes even with our family, because our works will be different. We'll be going on shifts, we'll be doing something, we're doing outdoor activities. So we should have a lot of patience, because we should control our blood pressure and diabetes under control. We cannot become automatically patients. So first thing, patience. Second thing, knowledge. It's like a power and the weapon where you can fight against everything. And I say every nurse should know their rights and their ethics. If you don't know or I don't know my rights, definitely we will be thrown out of everywhere. And future nurses, they should know their rights first thing.
Can you tell some of the rights, ma'am?
Rights.
Mm.
It's like right to dignity. You should hold your dignity. Okay. And professional rights. Like suppose there is someone mandates you to conduct some abortion or assist for an abortion or doing some an illegal surgeries. If they says you to do it, no, you can say, you can refuse it. If it is not for you, then why should you do it? I can say, no, it's my right to refuse. I can refuse it. So those things are most important. Maybe in your very first year, there is something in nursing foundation in the last chapters, code of ethics,
Code of ethics.
most important plan. Because to sustain as a nurse, not in India, everywhere, wherever you go, because now Indian nurses are working in all over world, I can say.
Yes, ma'am. This is I want to ask that, ma'am. Like, why Indian nurses are famous in all over the world? Why? What's the main like core reason?
Because Indian nurses are so strong.
Strong.
Not only that, the opportunities in India and the salary in India, we can say sometimes for the nurses is not so favorable.
Okay.
People who are getting posted or getting recruited in government, they are good. But coming in contractual people and the people who are working in normally in other private area, the opportunities and then salary, what they're getting in outside the India is more. So that is flying out because they want to try something new.
And like yeah, and one thing is, ma'am, as I experience, like we are more aligned with our cultures, so we know the real value, how to provide the like authentic care to the patient. I'm not comparing the other countries like the staffs, but yeah, for India, some India is have something which is like really cultural. We are providing the care like, because this is we are developed like this in our family, we taught like this, we know these things. It is good. And when one thing, like in this digital world, in community, what are the new challenges to deal with that as a community health officer?
As a community health officer in this new generation, handling adolescents is quite difficult.
Adolescence.
We can educate very easily the geriatric people and old age people or adults who can really understand something. But adolescents are not so because of extreme exposure to the technology. Sometimes the misuse of technology, which is actually making them to take some wrong decisions. We can see there are many of suicides are happening.
Yes.
Okay, depression, headache, and many of mental health related disorders can be seen in adolescents very early period, which is not actually required, right? Why they are making themselves to struggle so much? They can have their physical activity, they can do some sports, and they can do any kind of wonders in that particular age, but they are going behind something. So in community, making them understand, the person who comes in school children, sometimes even with the plus one plus two, whatever we say also, they're not in a state of understanding.
Hmm.
Okay, they'll just listen to, they say yes, and they'll go out and they'll do whatever they actually wanted to do, and getting you addicted to some of the habitual habits, and getting addicted to the smoking, alcohol, sometime even with some of the drugs, just actually taking our young generation to the wrong direction. Now what things has happened in fraction of seconds, we're getting tensed. See, automatically somebody who is sitting far away from can change our moods. That's not good. We should have the control, the mind we has to be in our control. Mobile or the technology or the digitals, whatever we, it should be in our control. Okay, it's just like the switch of this room. When we off it, it should get off, or when we on it, it should get on. But what is the happening in reverse? When it is calling, when mobile is calling,
We are going, yes.
we are going to it right now. It's not in our control. Actually, we are in its control. That shouldn't happen.
Ma'am, the Indian Health Ministries launches the various programs for a community. So, what's your role in those programs for their successful implementations? What's your role?
See, I tell you, in community health officer, we are totally working in ground level. Whatever comes from the ministry level, then to the state, then to the district, then to the taluk, then to the PSC. Finally, the person who is implementing all these programs are our HWC team. I can say as a CHO, and PHCEOs are will be there, and HIOs will be there, even ASHAs will be there. This is actually the, I can say, the core people who are actually working on every national health program. Every program which comes from the Ministry of Health and Family Welfare, whatever they want to implement into the public, it should getting implemented or getting it into the action. It's from this particular HWC team. HWC means like health and wellness clinics. We can now it has been changed as like Ayushman Arogya Mandira. So these are the people who are actually implementing it, who have the statistical data of their own villages and their people, and how many of them are working, who need this particular beneficiaries, and how the people has to take the benefit. For example, Janani Suraksha Yojana. So it's Janani Suraksha Yojana. So what itself is like it's
Mothers.
this. So we have to find the mothers to take the benefit out of it. Like that's the way. In the same way, even any kind of school health programs or any kind of geriatric programs, every program is getting implemented to the ground level. As a CHOs, most of the time we have to do all the ground level work. Okay, so instead of feeling it as like a burden, feel it like a challenge. Okay, maybe you may little feel like your color getting shaded in the sunlight and you may feel little sunburns, but you will get the ground data. Once you understand your community will automatically come to you. They themselves will come to you. They'll consider you as their family, and they'll talk to you. They'll ask you, when are you coming? When next time? Okay, please come, have some tea, sit with us. So that love and concerns are different. Okay. And by the time they may share their problems, they may openly say what is their issue. So all these national program, for example, last time this Ayushman Arogya cards will be given, PMJY cards, Pradhan Mantri Janani Arogya cards were given. So those also, the creation of the ABA cards and all was most often done by our CHOs. Even other agencies help was taken, but most of the responsibilities was given to the CHOs. So all these responsibilities will come to CHO.
Okay. We have the many postings, clinical postings and other psychiatric postings, community postings. As a student from this outside from this state, I'm from Bihar, ma'am, and they are in the Bangalore in my own college. We have lots of like, variety of people which is coming from different states. The one thing which challenged us uh, is the language, ma'am. So for us, for like other state students, what's your suggestions? How we will proceed to understand the language? Because the language is something by which we can understand the patients completely or perfectly, and we are lacking in that, ma'am. So do you have any suggestion on it
You are asking related to Karnataka or some
related to Karnataka?
related to Karnataka. Better whenever you get time, have time to talk to the people who are basically from Karnataka. And whenever you go on from buying some groceries or something, try to communicate with them in the Karnataka if you want to sustain in Karnataka. So what I really tell from the students from other states in India, it's really blessing for you, because you people travel to other state. I'm not saying only for Karnataka. You travel to other state to do your some higher educations. Most of them are not so lucky enough to have like,
Yes.
right. So you got some opportunity to understand the environment, culture, and how the people are from South India, because you are totally from North India. You can understand, you can see the culture of South India. So once you can imagine, after 10 years of your life, when you're standing in some podium and you will be explaining some students of yours the feel of you got from South India, or from basically from Karnataka, of different cultural experience, you may say into your tip of the tongue. You don't need to go through the books. That's right. So same way, every students in India, you got an opportunity to learn different languages. Maybe in your classroom itself you may have around minimum 4 to 5 different states students. Just learn the language, try to communicate, exchange your languages. See, learning our Indian languages really makes us feel wonder. Okay, once we go to their state, we can feel ourselves as our we are own. We own this state, right? And then in Karnataka, I don't feel it is so difficult for you if you start going outside. Maybe probably you guys are being students and always settled inside the hostel rooms. Maybe it's quite difficult. Once you come out and work in hospital sector or anywhere, hardly within 1 or 2 months you will learn many different words and makes the languages a little bit easy for you to understand. But learn the languages of India, which really makes you proud. I myself can say like I have learned around 6 languages of India.
6 languages.
Yes, I'm really proud of it because wherever if you throw me in this India, at least I can survive. Hindi is our official language. All over India we can survive. And English is automatically which came with academic, not an issue. In our mother tongue, not automatically. In other South Indian languages comes as like Tamil, Telugu and Malayalam. I don't have any issue. I can speak.
Wow.
Which really make me feel proud. And you people from different state also can try out. I can say nursing students, don't bind yourself like you're a nursing student, you're limited. No, you have an ocean of opportunity. It's one more thing I want to stress like, don't think only about the passing out from nursing or set and going as a CHO and doing something. You have even an opportunity to work as an IAS officer. You can work your own Bihar administrative officer will be there.
Yes, ma'am.
Yes, you can do that. The basic qualification required is only your degree. Rest of the things is download the syllabus of your things and start preparing for it. And this is the right time to start it from your third year, fourth year, and finally you can give up around other 6 months and start giving exams. You see yourself in different places. There are so many even. When I was studying in third year, I think exactly like you, and there was a speaker who came to our college, and she openly said like, I'm basically from nursing. I was doing nursing and she was an assistant DC, I think assistant DC of Mysore, and she was there. We really felt energetic that time. Okay, nursing students can really give that try. Okay, other even when other degree students are doing so, then why can't we do it? So don't restrain yourself for something limited. Give trial for everything. All the opportunities like it's like ocean of opportunity. Nursing is another level of pen or the weapon you have in your hand to survive your life, but don't get limited to it. Whatever you want to do it, you do it. There is even opportunity to do a MSc in anatomy, MSc in physics, psychology. There are so many things. It's not like you have to do only the nursing, MSc nursing, medical surgical or psychiatry pediatric. Not so, you can do even other medical subjects also. Even genetics is also available. Like that, we just have to do little research on it, choose which is passionate for you, then go with that.
Okay, ma'am. And ma'am, thank you for joining our podcast because, like, in this short notice, you came and joined us. It's like something really blessing for us. And ma'am, we have a small gift for you.
Oh no, thank you so much.
If you want to tell anything our viewers, you can tell us.
Nothing much special. I just really enjoyed you guys when I was teaching you when you were first year. The very first class when I took, I understood the level of students. Who is my audience? I understood. So very next day, I myself felt like I need to prepare a lot before taking a class. Okay, because when audience are so strong, the like person who is presenting also need to be prepared a lot to at least to capable of answering some of the questions. So I really felt very happy to have a students like you as my students. So I really felt very happy to have a student like you guys. Really happy about it. And viewers are waiting since a lot of time and especially spend little this much of arrangements and all. I'm very happy that I got an opportunity to talk to you guys. Happy about it.
Thank you.
Oh, fine. Thank you.
So thank you with having us. Bye. Have a nice day.